The University of Maryland St. Joseph Medical Center has undergone some new changes. Joining us today is President and CEO, Dr. Mohan Suntha. Welcome.
Thank you so much.
You've taken sort of a different path to get to where you are as CEO of this hospital. You bring both your work as a doctor and you're an administrator. So it's sort of an unusual trip. Tell us about your journey.
Well, so I, born and raised in Philadelphia, went to medical school in Philadelphia and then came to Baltimore in 1991 to do my residency at University of Maryland in radiation oncology. Did my residency, went on and did a fellowship and joined the faculty in 1995, assuming that I was going to follow a traditional career path in academic medicine. And while I stayed focused on academic medicine, there was opportunity in the medical system to also grow my administrative roles. And ultimately, that led to an opportunity as the University of Maryland acquired the assets of St. Joseph Medical Center to take on a leadership role at St. Joseph's. So it's been a phenomenal opportunity.
And so along the way, you got your MBA as well.
I did. I went back and thanks to the support of a number of individuals, I was able to complete my MBA at Wharton up in Philadelphia while I was maintaining my research and clinical practice at the university.
So how has that been helpful? How have the staff members seen your ability to lead with, being a doctor and an administrator?
Obviously I come at it with somewhat of a biased perspective, but I think there is great value to having physician leadership in the boardroom as administrative decisions have to be made about the direction of the health system, and in this case the direction of St. Joseph's. There is no question that the physicians at St. Joe's as well as the faculty of the University of Maryland School of Medicine have been phenomenal partners in trying to help drive the future direction of St. Joseph Medical Center.
And being a part of the University of Maryland system allows you to do more clinical research. How is that essential to a hospital and to the community at large?
Yeah, again, I think there's no question that the future of medicine in this country is going to be driven by our ability to continue to focus on new developments in healthcare and advancing healthcare. Academic health systems, academic medical centers are critical to that conversation. And I think, again, what we're able to do now at University of Maryland St. Joseph Medical Center is align the clinical programs at St. Joe's with the very strong clinical and research infrastructure that exists at the University of Maryland. And so I think it brings opportunity for clinical research to expand beyond the traditional walls of an academic medical center to now include an academic health system.
Mm-hmm. And why are those clinical trials so important, especially in a hospital setting?
I think there's no question that when you think about how we've advanced healthcare in this country, a large majority of that advancement has been driven by successful clinical research. Clinical research requires physicians and healthcare providers to provide access to patients. Mm-hmm. And when you think about where healthcare is delivered in the acute care setting, a majority of that care is provided in community hospitals. So the opportunity to bring that research into the community provides opportunity for patients to access these novel treatment approaches.
And people here in the state of Maryland, and in particular here in Baltimore, they have so many choices when it comes to hospitals. And now St. Joseph's, St. Joseph at University of Maryland it's a community hospital. And so what is that role and how important are community hospitals? I think community hospitals, again, play a vital role to maintaining the health of a community, obviously. But, I think St. Joe's is an example of how a community hospital is woven into the entire community. When you think about St. Joe's, we are very proud and excited to be celebrating the 150th year of St. Joseph's in 2014. And when you think about it, the presence that this hospital has had in the community goes far beyond just the acute care medicine that is practiced within the walls. I have met so many people in the community who have defined
a number of experiences that are interwoven with the physicians and the caretakers who provided care not just within the hospital but within the community. The support we have, the partnerships we have. An example, Towson University is literally across the street from our campus, and the partnerships we have to work with the students of Towson to provide them opportunity, that is all part of how you define a hospital's role within a community.
And was that something that was available before the University of Maryland came on board?
I think there's no question that the University of Maryland relationship has strengthened the bond between Towson. There was always, as neighbors, there was always a partnership that I think was defined. No question now the president of Towson University serves on our board. We are looking towards research opportunities to expand allied health opportunities within the hospital for students at Towson.
That's great. For students who want to be researchers, doctors, nurses, it's amazing.
It really is. It really does help open up those opportunities.
All right. You're going to be with us some more. We're going to talk to you a little bit more. Stay with us. More with St. Joe CEO Dr. Mohan Suntha when we return. Don't go away. You're watching 11 TV Hill. Welcome back to 11 TV Hill. We're joined today with St. Joe's President and CEO Dr. Mohan Suntha. Welcome back.
Thank you.
Let's talk a little bit about healthcare and the healthcare industry. Right now, healthcare is certainly a major concern for Americans today. And how is the industry responding to their healthcare concerns? Are you rising to the occasion?
Yeah, I would hope that folks would appreciate that the hospital community and the School of Medicine are clearly attempting to rise to the needs of our communities as we all collectively figure out a strategy to move forward successfully with changes associated in healthcare. I think we can all agree that there are some challenges that we need to collectively face and work hard to figure out how to align hospitals and physicians for the betterment of the patients that we serve. And I think we've had a lot of success in doing it. No question we have challenges that we will face, but we need to face them together.
Well, we're going to be facing it with the Affordable Health Care Act, and in your opinion, has this been a positive thing for the healthcare industry and for people here in Maryland? Is it going to help us in our medical with our medical concerns?
Look, I think there's certainly been a lot of discussion about the Affordable Care Act, and I know there are a lot of opinions, but I think, again, I'm a big believer in figuring out where there are commonalities, and I think one thing that we all would agree on is that the notion of improving healthcare coverage for citizens in this country is a good thing. And so how we do it and how do we effectively ensure that hospitals where acute care services need to be provided and physicians who provide those cares are adequately funded to be able to serve the needs of the community, where the challenges lie. I think hospitals need to take on the challenge of thinking beyond what we historically thought of as our role, and think beyond just that acute care setting, and think about now the continuum of care from, what do we need to do in preventative health and population. What's our role as a hospital in the conversation about population health management, all the way to once a patient leaves our hospital, what are we doing to help ensure that that patient doesn't inadvertently return to our hospital because of issues that could have been addressed while they were here with us the first time. Those are the type of challenges that I think we as a hospital industry face, and we'll continue the conversation. I know we're very focused on it within the University of Maryland system.
Right, and I think that one of the things that maybe one of the biggest criticisms you might have from the public as a hospital, not just you, but hospitals in general, is that people feel that they are nickel and dimed when they are there. That
Right.
They can't get this because this health. The first question is, where's your insurance card?
Right.
And how do you begin to deal with that to a certain point where patients don't feel like they are just, if you don't have an insurance card, forget it.
Well, I think that part of that is the transparency that is required. What you're seeing now in this national conversation about healthcare is moving from the concept of volume-based reimbursement to quality-based reimbursement. And I think if we focus on identifying quality metrics that we can agree on and communicating quality. Again, transparency means a patient should be able to understand, what are the quality outcomes when I go to hospital X, or I'm thinking about going to hospital Y. I think that kind of information empowers the patient. And if you empower the patient, then I think that they're going to be able to make better choices. And so part of that conversation, remember, in Maryland, we have a very unique reimbursement system. For hospitals, we have a rate commission, and that commission helps us with the issue of how people pay for their health care. Mm-hmm. So it doesn't really matter whether you're Medicare, Medicaid, Blue Cross, any insurance, the rates within the hospital are set by the commission. That helps with that transparency.
Let's talk a little bit about the new University of Maryland St. Joe. St. Joe for years in this community has been known as the hospital to go to if you have a heart, for some reason in this area, if you have a heart issue, to go to St. Joe's. Then you underwent that situation where one of the star doctors there came under controversy for stents. What do you want people to know about the new University of Maryland St. Joe's, that you're in terms of all of that?
Yeah, so what I would say is we are still very proud of some of these signature clinical programs like cardiac services, orthopedic services, cancer, mother-baby services, things that have been the hallmark of St. Joe's. But we are also an institution that is very focused on on primary care. What you're going to see is, over the next few years, you're going to see us expand our footprint beyond just our Towson campus, because we believe that, again, providing access to primary care providers is really the cornerstone of how we're going to help revitalize St. Joe's. And so I think that will be a major focus for us. I love to remind people that the story of St. Joseph Medical Center is a 150-year story. So it is a novel. It is not a short story. And so while the last few chapters may have been made for interesting reading, we have turned the page and are very focused on the future.
Okay, we only have a few seconds left, but what's the one thing that St. Joe's is bringing now to the community?
I think we will continue to bring excellence in patients' care, and we will continue to do that. We will partner with the community to make sure that folks understand that we are going to be here for the next 150 years.
All right, so thank you so much for coming in.
All right, thank you.
All right.